Hi everybody, my name is Sydney Davis. I am currently enrolled in the paramedic program at Lone Star College and the Methods of Teaching program. I am currently working to get my associates in paramedicine and my licensed paramedic. So today, I have the honor of teaching you about one of my favorite medications that is sadly no longer used in the United States. The FDA unfortunately banned this medication in 1999 because they deemed that the short-term effects were not worth the long-term effects that followed. Today, we get to talk about the green whistle, or Penthrox. The U.S. pharmacopoeia name for that medication is methoxyflurane. So methoxyflurane, as noted, is an oral analgesic, and it also comes in an injection form. Unfortunately, a lot of people have said that the injection is not as efficient and effective for pain management as the oral inhalant. So, my favorite thing to say to remember what this medication is used for is whistle while you hurt. I think it's cute, it's catchy, it's always stuck with me. So, whistle while you hurt is equal to the green whistle. So we're gonna delve into the pharmacokinetics of this medication. So methoxyflurane, or Penthrox, is a central nervous system depressant, or a CNS depressant. And it helps reduce the pain sensitivity by altering the chemistry temporarily, causing tissue excitability. So it extends the cell coupling and alters the activity between the channels that underlie the action potential. So pretty much your nerves are going to be firing off saying, hey brain, this really hurts. Please help. Please make it stop. So it's going to cause excited neurons, excited nerves, and your body can't really react on the arc reflex at this point. You can't pull away from it. So everything just gets really excited. You're in a lot of pain. You don't know what to do. When this medication helps come in and say, hey, let's just chill out, just whistle while you hurt, and I'm gonna help extend that gap reflex and the gap time, the gap junction mediated cell coupling. So the active ingredient in this medication is methoxyflurane. It's one simple ingredient, that's all. And as I said, it's going to affect the central nervous system. So that's going to be the brain and the spinal cord. Both have a lot of nerves, nerve sensors. As I said, the nerves are firing, you're going to be like, ow, this really hurts, please stop, but you can't. So this really helps kind of depress all of those nerves firing, and it helps reduce the excitability and the pain that the nerves are experiencing. So the pain relief will start after 6 to 8 puffs or breaths of this medication and continue for several minutes after stopping inhalation. So the continuous use of one dose, which is 3 milliliters of methoxyflurane, or Penthrox, is going to create a pain relief of 25 minutes. Crazy. From 3 milliliters of oral inhalant. So you can also administer a second dose of 3 milliliters, so that's 6 in total, for an hour of pain relief. That's a long trip. Hopefully we don't have to go that far, but there we go. You do not, and I cannot stress this enough, want to go over 6 milliliters. It can really, really hurt the patient. We do not want that at all. On the contrary, if it's a person who has chronic pain that uses this daily, that uses this weekly, you cannot go over 15 milliliters per week. So, big difference. Math kind of doesn't add up, but trust me, there's a reason for it. So, the indications of this medication, first and foremost, they have to be an adult. The trickiest thing, I'm sure as most of y'all know, is pediatrics have different dosing on all medications. Unfortunately, with this medication, we cannot control the dosing. So it only comes in 3 milliliter canisters that you will insert into a inhaler or inhalant device. So it's not advised for pediatrics at all. You're going to use it for adults with trauma, moderate to severe pain, whether it is short-term or chronic. You are going to use it for fractures, dislocations, and again, do not exceed a dose of 6 milliliters in one round and 15 in 1 week, okay? Okay, so the contraindications are going to be recent head injury, drug sensitivity and drug allergy, which is kind of a given. We don't want to give a drug that somebody is going to have an anaphylactic reaction to, or something that's going to really, really hinder the patient. We don't want that. We are here to help people. So do not give it to somebody with an allergy to it or with a sensitivity to it. We also don't want to give it to somebody with heart disease or kidney disease. The reason for this is because, again, it is a depressant. We don't want to send them into an arrhythmia where we have to cardiovert them. We are here to help, not hurt. You don't want to give it to somebody with kidney disease because the FDA has found that this drug has long-term effect on the kidneys. As most over-the-counter drugs might have and do have, they just prefer not to introduce that. It is also a Class C pregnancy drug. I do want to say that now so I don't forget in the future. It is a Class C pregnancy drug. They have done testing on pregnant animals, but they don't know enough about how it affects pregnant females. We don't want to test it. We don't want to be the ones to do the science experiment on that. Leave it to the hospital, okay? It is also not advised for people with recent alcohol consumption. The reason for that is this is going to be a mind-altering medication. It's going to make you a little loopy, just like laughing gas would do. We don't want to have somebody who's already in an altered mental state and make them a little more loopy for several reasons. A, we need to know what a baseline is. If somebody's already altered, we don't want to alter them more because that can hide several other things that might be going on. On top of that, people with alcohol can be a little wild sometimes. So we don't want to give them something that can either turn them violent, something that can end up hurting us, something that can end up hurting them, and also we don't want to make them sick and have them vomit all over our ambulance. It's nasty. I know I don't want to deal with that. So don't give it to somebody that has alcohol in their system, please. A big thing is malignancy hypothermia too. We do not want to give it to anybody that has a history in themselves or their family, whether it's paternal, maternal side, themselves, their kids. We don't want to risk that. Malignancy hypothermia, I can say, is one of the scariest things. And I didn't know about it until recently when my daughter went under surgery to get her tubes. Freaked me out when I found out about it. So let me introduce that to you. Malignancy hypothermia is a reaction to any sedative, especially if they are going under. It will send your body into a hypothermic state, and a lot of people have passed away from this, unfortunately. I don't want to deal with that on my ambulance. I don't want the families to have to deal with that. I don't want to be having somebody who already has trauma and then them dying on my ambulance because I gave them an anesthetic because I didn't ask, hey, by the way, you know? So make sure that that is one of the things that you ask because it is a very, very scary thing. You do not want to have a hurt patient with the potential of already going into hypothermia and send them straight into it, you know? It's not worth it. Again, young kids. We can't control the dosage. We don't want to give it to young kids. You don't want to give it to people with a history of high fevers as well, due to the fact that this drug can produce a fever. We don't want to make a higher fever than what they are already suffering with. It's not good. We don't want to cause more problems. You don't want to give it to somebody that has trouble breathing. Again, this is a CNS depressant. It is going to send your body from fight and flight to rest and digest. You are going to be able to mellow out. That means lower heart rate. It's going to help kind of slow everything down. Don't give it to somebody that already has issues breathing because you will be bagging them in the back of the ambulance. We do not want that from an oral analgesic, right? If they do that, it's on their own. I don't want to be the reason why I have to bag somebody, you know? Fun fact also, something I learned recently, you do not want to be giving it to somebody on tuberculosis antibiotics. So 2 of those main antibiotics, and excuse me if I mispronounce, is isoniazid and rifampicin. It's a hard one. Rifampicin. Those are both tuberculosis antibiotics. Don't give it to them if they're on that medication. Also phenobarbital and oxycodone. Those are already kind of making your brain relax, your body relax. Don't make it relax more. You also don't want to be giving it to somebody with blood pressure issues, as that can change their blood pressure even more. Okay? So the contraindication acronym that I have found that I have loved and I will use if this medication ever comes back in the USA is check. So the first C stands for clinically significant cardiac or respiratory disease. You don't want to be giving it to somebody, as I said, with kidney disease or heart disease. It's not going to be a fun time. We don't want to make it hurt more. So the H is hypersensitivity to this drug, methoxyflurane, or any fluorinated anesthetic. Okay? We don't want to do that. It's a contraindication. It's bad. Okay, so the E is established or history of malignant hypothermia. We don't want a person to die in the back because we gave them a bad medication that sent them into a hypothermia after they're already dealing with trauma. Consciousness altered. We need a good baseline. We're not going to sit here and alter somebody even more than what they were already altered. As I said before, it can hide a lot of things that might be going on internally. And kidney or liver disease. It can hurt the kidneys, it can hurt the liver. We don't want to be a reason that it hurts even more because we cannot control how much they're getting.